A bracket or a band can become distorted or displaced, and it's usually because of eating the wrong foods, chewing on something hard, or picking at your braces. It's not an emergency unless discomfort is involved. However, you need to call the office to schedule an appointment to replace the damaged loose band or bracket. You'll be seen as soon as possible. These appointments require some extra time and usually can't be done after school or work hours. If a rubber elastic ring or tie comes off, we can get you in for a short visit to have it replaced. In areas where there is a long span of wire, it may come out of the back tooth. If this happens, you may try to reinsert it into the tooth using a pair of tweezers or place wax to hold it in place. As a last resort, you may cut the wire next to the closest bracket using a nail clipper or a small wire cutter. Remember to call your orthodontist before attempting this. For a pokey tie wire or a wire poking out of the back braces, we suggest that you use the back of a pencil eraser to tuck it out of harm's way. If that's not possible, use a piece of wax to cover the area causing the irritation until you can get in for a quick visit. Apply by pinching off a small portion and rolling it into a small ball. The key to getting the wax to adhere is to dry off all saliva around the irritation. Then place a small ball of wax where it's needed and gently mold it with your fingers until it's comfortable. Remove the wax to eat or brush and reapply if necessary. The doctor will give you an ample supply of this wax when you get your braces. And remember, whenever you are having difficulty, feel free to call the office so that your questions can be answered and the appropriate appointment can be scheduled.